ReachMD XM160 now presents reaction to President Barack Obama's speech at the 2009 AMA House of Delegates meeting in Chicago.
It's Dr. John Armstrong for ReachMD XM160 here on the floor of the American Medical Association House of Delegates. We have just heard President Barack Obama share his vision for health system reform in America, issuing a call to America's doctors, "I need your help." Dr. Richard Reiling is a general surgeon from Charlotte, North Carolina with the American College of Surgeons. Dr. Reiling, did you hear what you expected to hear?
But I think there's a well-balanced speech. He's a very eloquent speaker and presented all the points that we're looking at. So I think we heard what we wanted to see. We have to work with him. We have to carry on in this arena, working with the president. He looks like he's ready to be workable, and he's going to be in our camp. So yes, it did. Thank you.
Thank you, Dr. Reiling. We're here with Dr. Charles Logan, a urologist from Arkansas. How do you think his speech is going to affect America's physicians?
Oh, I think it'll be accepted by the majority of Americans. I think he hit on a lot of high points that all of us are concerned about, and the cost of health care today and the fact where we're going. We can't, as he said, we can't continue in that direction. And, I think there'll be some extensive debate about some of the issues he talked about, but I think if we work together, we can come up with a plan that can really remodel and remold our healthcare system and make it more workable than it's going to be if we don't.
Thank you, Dr. Logan. Dr. Ken Serta from Philadelphia, Pennsylvania, a psychiatrist with the American Psychiatric Association. Did you hear what you thought you were going to hear from President Obama?
Yeah, I did. It's nice that it's clear that he is hearing us. He was able to appropriately anticipate all the things that we would have concerns about. The devil is in the details. What this health exchange is going to be is very unclear, and how he is going to be able to avoid having a lot of people in more expensive plans rush to the health exchange, and what that will be for people in my profession, what kind of mental health coverage is going to be in this health exchange. It could be, it'll be very interesting to see what the details are.
Thank you, Dr. Serta. With Dr. Tom Russell, Executive Director of the American College of Surgeons. Dr. Russell, what do you think this speech will mean for health system reform in America?
Well, I think he gave a very good speech. I was impressed by his knowledge, overall knowledge of the healthcare issues and the problems. He's obviously talked to a lot of people, and I think he's got some great solutions. But it's going to be change, and this is going to be threatening to a lot of the stakeholders. So I think I'm impressed by the content and his ideas, his passion. He's resolute, and now what we have to do is start to give up some of our old held views and start moving in this path. I think he's made a very strong case that this is not optional. This has to be done.
So in essence, we are still looking for change we can believe in.
That's correct. I think we can believe in change, and there's not many doctors out there that don't realize that pretty much everything he said is true.
Well, thank you, Dr. Russell.
Okay.
We're here with Dr. Cindy Yag-Howard from the American Academy of Dermatology in Naples, Florida, as well as several of her colleagues. Let's hear what you all thought about President Barack Obama's address to the American Medical Association House of Delegates.
I was thrilled that he was receptive to our concerns, yet I am concerned because I heard him speak about bundling, and I think we're going to be held to a higher standard, even higher than we're already held now, without any protection from liability. Those are my two main concerns from the speech today.
Well, thank you, Cindy. Dr. Colette Willans, a family physician from Ohio. Colette, what was your take on his speech?
I was excited to hear him willing to work with us and acknowledging the fact that patients trust their doctors, and with good reason, and that he knows he should trust us too. He doesn't need to hold anything over our heads. He just needs to help us have the information we need to do the right thing, which is always what we've done and always what we will want to do for our patients. I was a little concerned with the idea that he wants us to try to tone down on some care areas, save some money, because we all know that the attorneys are always looking at that for a reason to haul us into court because we didn't do everything possible, even when it wasn't necessarily the best thing for the person.
I have Dr. Ravi Goyal, an ophthalmologist from New Jersey, with me, again here on the floor of the American Medical Association House of Delegates, where President Barack Obama has just shared his vision for health care in America. Tell me, Ravi, did you like what you heard?
John, the president made a home run. He came to the AMA, he came to the place where physicians are citizens first, we're physicians second. It's a house of medicine. We all have a common interest in our fellow citizens, our patients. We didn't like everything that he said, but he was frank, he was honest, he outlined great proposals, and he's willing to listen to us openly, to work with us, to bring all the coalitions together, to bring all the partners together, to have straight talk, and to find a solution. The one thing I was most struck with was when he said that, look, he listens to us, his wife listens to us, his kids listen to us, the patients listen to us. And now we all have to come to the table. It's a it's a give and take process, but I think that he hit a home run today.
So you feel that physicians in general and the American Medical Association in particular are both at the table?
Absolutely. The president's got to come. The president has come together. He's brought the Congress together, the insurance companies, the medical alliance, medical specialties. Now's the time to act.
Well, thank you very much, Dr. Goyal.
You're listening to continuing coverage of the 2009 AMA House of Delegates meeting in Chicago with host Dr. John Armstrong on ReachMD XM160.
So, Steve Epstein, an emergency physician from Boston, Massachusetts. What do you think about President Barack Obama's speech?
Well, I think it was a very comprehensive speech where he outlined his entire plan of health, and I'm delighted that he chose the American Medical Association as the venue to do that. I think he's proposed a very comprehensive program, but as he said, we have to do reform. The devil that we don't know may in fact be better than the devil we know, but I would add that the devil of all of this is really in the details. And he clearly heard some strong response when he spoke a little bit about liability reform, and I'm sure that me and my colleagues here look forward to working on those details as time goes on with this healthcare reform process.
Well, thank you, Dr. Epstein. And Dr. Bruce Scott, an otolaryngologist from Louisville, Kentucky. Bruce, what did you hear in Barack Obama's speech that you expected?
The best thing that I heard was when he said that he trusts doctors and he thinks that they are willing to listen to doctors. And hopefully that means they're willing to listen to the American Medical Association, the organization that represents physicians in the country. The thing I'm concerned about is he drew his biggest applause lines when he pointed out problems, and then when he provided details, the applause seemed to fade away. So I hope that that's not going to be the earmark of what we see through the entire process. We've really got to get to the details and figure out whether the reforms are going to work. He did point out several times that we need to make sure we don't lose what works within our healthcare system.
And that seemed to resonate very well with this audience.
It very much did. I mean, his biggest applause lines of the day were when he said that we have to do something to cover all the Americans, when he said that we as physicians should be allowed to do what we went into medicine for, and that is specifically to take care of patients.
Well, thank you very much, Dr. Scott. We have Lisa Egbert, an obstetrician gynecologist from Ohio. Lisa, what are your thoughts about President Barack Obama's speech moments ago?
Well, I'm very encouraged that he seems to finally understand that medicine needs to be a part of the debate, and hopefully I think he has a good idea of what's important to us, because we want to make sure that all of our patients are covered and that all of our patients can choose their doctor and can stay with their doctor.
Do you think he understands what's going on in the minds of America's physicians?
I feel like he understands better than many politicians that I've heard before, which encourages me. I think at least he understands the importance that we have a voice and that voice be available to him throughout this process.
So we have a seat at the table, you think?
I think we have a seat at the table. That's the best news yet.
Isn't that? Thank you, Dr. Egbert. I'm here with Colonel and Dr. Paul Friedrichs, an Air Force physician. You've just heard the Commander-in-Chief speak. What are your thoughts at this moment?
I thought it was a remarkable speech because he addressed every major concern that we've articulated in the House of Medicine. More importantly, as a serving physician in the United States Air Force, he addressed all of our responsibilities in the public and the private sector to improve health care. I thought it was a wonderful, wonderful speech.
Well, and certainly, Colonel Friedrichs, we thank you for your service to our country. We have Dr. Patrice Burgess, a family physician from Idaho. Dr. Burgess, you have just heard President Barack Obama address really the nation about his vision for health care. How does his speech resonate with you as you reflect on your practice in Idaho?
I was just very impressed with the depth of knowledge that President Obama had and how he really seems to understand what's wrong with our healthcare system. So very excited and a little nervous about some of the details, but excited that he seems to understand what our situation really is.
Is your sense that he's willing to help doctors help patients in this reform effort?
I do, and I think he's the first person that we've had that's actually reached out to physicians and reached out to the AMA like this and included us in healthcare reform, which is very exciting.
Well, thank you, Dr. Burgess. We're here with Dr. Darlene Menser, a geriatric physician from North Carolina. Dr. Menser, did you hear what you thought you were going to hear from President Barack Obama?
Actually, I did, and I thought he was very courageous to come into the House of Medicine where he knew he had both friends and some who are concerned about some of his policies and be very candid and complete and to say what he really is going to do. He didn't just tell us what we wanted to hear, although much of what he said was very encouraging to me. As someone who takes care of a lot of older adults, we certainly can't continue the Medicare system as it is now, and I appreciate his courage in saying that things need to change.
Do you think his speech will move the reform effort forward?
I think that his speech was as much to all of America as it was to us, and I think it's the most that I've heard him say at any one place and any one time about this, and so I think it is step one of his statements to the American people about health care, and so I think in that sense it would. How much he moved physicians, I think we pretty much understood before he came how he felt. But I appreciate him not watering that down or changing it for us. He was honest, and we have many areas of agreement, and I look forward to his succeeding in those areas where we can support him.
Thank you very much, Dr. Menser.
I thought it was very comprehensive.
Dr. John Armstrong back again with Dr. Don Chaplin from North Carolina. Dr. Chaplin, what did you think about President Barack Obama's speech?
Well, I was enthusiastic and surprised, and I thought he did a great job. I actually had a feeling that he was probably a primary care doctor of over 30 years of experience, the way he articulated our challenges and needs, and at least he had demonstrated an understanding of what we needed and what our patients needed.
So you sense that he'd been at the bedside a time or two?
Well, I sense that he had a better grasp than we've seen in a long time from chief executives in Washington.
Do you think his speech will move forward the health system reform effort?
I think it'll be a good catalyst to help us to find some better common grounds in which we all need to work.
Very good. Thank you very much, Don. We have been here on the floor of the House of Delegates of the American Medical Association, capturing initial reaction to President Barack Obama's address to the members of the American Medical Association and really to the American people regarding his vision for healthcare delivery in America. Clearly, very much an inspirational address to the nation, and yet a few areas where there will remain substantive challenges. He was candid in his assessment. He was received warmly by this House of Delegates, and very clearly the American Medical Association and the physicians of America have a seat at the table in moving health system reform forward. Thank you very much, Dr. John Armstrong, reporting from the American Medical Association House of Delegates annual meeting in Chicago, Illinois.
Thank you for listening to ReachMD XM160 coverage of the 2009 AMA House of Delegates meeting in Chicago. Stay with ReachMD all this week for continuing coverage of the 2009 AMA House of Delegates meeting. For more information, please visit us online at reachmd.com.